Hello guys, myself Dr. Sahu Chandrakant recently scored 223 in the FMG exam, and I have come up with a new idea of 30 days 30 medical conditions challenge. And the topic for today's discussion would be pulmonary hypertension. The artery carries deoxygenated blood from our right heart to our lungs. Normally its pressure is almost around 8 to 20 mmHg, average considered as 14. But whenever this pressure increases above 20 mmHg, it is called as pulmonary artery hypertension. Now, what are the causes to that? Sometimes it's idiopathic, sometimes it's familial. It can also be caused by infections like schistosomiasis or some drugs. And sometimes it's caused by connective tissue disorders like systemic sclerosis. And how do we identify it? Usually, obviously, we can't put BP cuff to our pulmonary artery, right? So we usually go with the right heart catheterization. Now we'll talk about the complications of it. Since there is high pressure in the pulmonary artery, it causes pooling of blood back into the right ventricle. And whenever that happens, we see right ventricular hypertrophy or failure. We can also see syncope or exercise intolerance in the patient because the blood going to the left ventricle or to the whole body is getting low. And we can also see hemoptysis. Now, talking about the treatment of it, we can either go with the oxygen therapy or we can use drugs that help us dilate the pulmonary artery, like calcium channel blockers, endothelin receptor antagonists, phosphodiesterase 5 inhibitors, and in the final long term, we can also look for the lung transplantation. So that's all for pulmonary artery hypertension, guys. I hope you liked it and see you in the next reel.